Again, ladies and gentlemen, welcome to the Life and Breath Foundation Speaker Series. My name is Sean Hall. I am the president and founder of the Life and Breath Foundation. So for those of you who are new to the Speaker Series, welcome. And those that are returning, happy to see you and glad you joined us this evening. Our topic this evening is combating stress when you have sarcoidosis. As I mentioned earlier, my name is Sean Hall. I'm the founder and president. I wanted to tell you a little bit more about the Life and Breath Foundation and why we exist. Our primary goals are to offer the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize their quality of life. We also are centered on providing a nurturing environment for those affected by sarcoidosis to share their experiences. We think that the speaker series is a wonderful way to do that, introducing various speakers from all across the country to be able to come in and pass along helpful information that helps patients and their caregivers manage the effects of the disease, understanding that they are affected in many ways depending on what organ is affected. Last of which, our goal is to build an awareness within the medical community to help combat this chronic disease. So we think it's a helpful balance between educating the patients, their caregivers, and physicians to be able to treat, interact, and diagnose the earlier stages of sarcoidosis. So we are a volunteer-led organization. The money we received in donations and sponsorships go directly to helping patients that are directly affected with sarcoidosis. Some of the services that we deliver include the monthly speaker series that I just mentioned. We have the replays that are set up on our YouTube channel, which you can find at YouTube at Life and Breath Foundation. Also, we sponsor Life and Breath Scholars on an annual basis. That represents our dedication to physician education. So we work with resident physicians that are in the stages of learning more about this disease, more about their particular practice. So we are looking at them as ambassadors to sarcoidosis, for them to be able to be aware of sarcoidosis as they come into contact throughout their practice, throughout their remaining career. We also have a patient support that we are dedicated to provide for sarcoidosis patients, where we bring in experts. We allow them to connect with our experts from around the country to be able to ask questions, things of that nature. And then we also have a sarcoidosis Life and Breath planner. It is the Life and Breath planner that is going to help you detail how to manage the effects of your disease, help you with your interactions with your physician. So we're happy to deliver those type of services, but more importantly, we are very proud to be able to present our guest speaker this evening, Dr. Richard Harris. He's a board-certified pharmacist and holistic lifestyle internal physician out of Houston, Texas, with a passion to educate. Dr. Harris utilizes the holistic approach to wellness. So we are very happy to have Dr. Harris with us this evening, and we're also very intrigued and interested to find out more about the effects of combating stress when you have sarcoidosis. So Dr. Harris, before you start, we wanted to outline a disclaimer that this webinar will not be given medical advice. There is no doctor-patient relationship, which has been established by talking with Dr. Harris, asking questions, or interacting with him during this presentation. Our speaker does not know your medical background and therefore cannot give you specific medical advice. We encourage you to speak with your doctor before acting on any information that's shared this evening. Without further ado, Dr. Harris, we're very happy to have you, and thank you again for joining us.
Oh, thanks for having me again. All right, so stress. Something very important, especially as we've seen throughout the pandemic and now into what this post-pandemic world looks like. Stress is a part of our everyday life. We can't get rid of stress, but there are things that we can do to help mitigate stress and even make ourselves more resilient to stress. And that's what we're going to talk about today. My background is, as Sean mentioned, I'm an internal medicine physician, I'm a pharmacist, and my passion is really lifestyle medicine. And lifestyle medicine is what we do on a daily basis, can add to our health or subtract from our health. And my goal is really to give people the tools that they can live a life full of purpose and joy, utilizing the principles of lifestyle medicine. So, the first thing we have to talk about is all stress bad? And just like, my mom taught me when I was a kid, things aren't black and white. There's good stress and there's bad stress. And there's two ways you can break this down. One way is acute versus chronic stress. And we look at mostly the main stress hormone, cortisol. Probably many of you have heard of cortisol, released by the adrenal glands. It's the main hormone that our body utilizes for stress. Now, there are other hormones like norepinephrine and epinephrine that are involved in this pathway, but cortisol is the main one. What happens with acute cortisol elevations? Let's say you run into a grizzly bear. Initially, your cortisol levels are going to elevate. And part of that is to reduce anxiety so that you are able to think and act in a clear manner. Cortisol is also going to raise your blood pressure and raise your blood sugar, so you can pump from your heart to your muscles to get you moving in case you need to fight or flee. So acute stress is a result of something that happens in our environment. Now, that is supposed to come up and then come down. We're supposed to go back to a baseline level. This is something called homeostasis, where your body has a set point. So again, if I punch you in the arm, or let's say we go even further, you break your arm, there's an acute stress response that happens to get your body to start healing. Now, the problem is when that acute response goes over into a chronic response. Now, chronic stress, you get a different response. It's an exaggerated response. You get sensitization. So what happens here is the emotional processing center in the brain, the amygdala, also deals with fear and stress. It gets sensitized. So you begin to have a lower stress threshold, a lower anxiety threshold. So something that used to take maybe your anxiety level to a 1 now takes you up to a 4 because you've been chronically stressed and you've been sensitized. So chronic stress is a problem. Now, the other way you can think about this is eustress versus distress. Now, eustress is actually stressors that are beneficial to us. It's like the old saying, what doesn't kill you makes you stronger. This is eustress. So if I told you that I was going to acutely raise your blood pressure, raise your heart rate, increase markers of oxidative stress, increase markers of tissue damage, you'd probably say that's a really bad thing, right? Exercise does that. An acute bout of exercise raises your blood pressure, raises your heart rate, causes cell damage, increases oxidative stress. Chronic exercise decreases all of those things. We're going to talk about that more in a minute because exercise, it does a wonderful for stress. And then you have distress. These are things that send our system out of whack. Remember, I mentioned homeostasis earlier. That's our body's balancing process. Homeostasis is essentially like, okay, if I shove you kind of slightly, you might tip, but you'll stand back up, right? You might be knocked off center for a little bit, but you'll stand up. Versus if I come and I have a gorilla with me and the gorilla shoves you, you're probably going to go flying. You're not going to be able to balance yourself, right? That is distress. And that is the type of stress that we typically think about when we think about stress. So again, the whole purpose of this is not all stress is bad stress. Now, what are the health issues associated with chronic stress? People, when I was in practice, in the standard, community practice, people refuse to believe that stress could be causing or contributing to their health issues. We know for mental health, Stress has been linked to just about every single mental health condition you can possibly think of: anxiety, depression, PTSD, bipolar disorder, schizophrenia, eating disorders. And what's interesting about the mental health disorders is when you have one mental health disorder, it dramatically increases your risk of developing another mental health disorder. And then you look at physical disorders. Well, stress has been linked to the metabolic disorders, things like diabetes, high blood pressure, eh, more infections, fertility issues, chronic gut issues, autoimmune disease, and obesity. All of these things have been linked to chronic stress. So one of the things chronic stress does is something that most people are probably familiar with: stress eating. So what happens in animal models is chronic stress increases a hormone called ghrelin. Ghrelin, in medical school, they teach us to think about like growling because it makes you hungry. So we tend to eat more when we're stressed. Also, there's a hormone that counteracts this called leptin. Leptin is a satiety hormone. Leptin kind of acts as brakes in the brain and the adrenals to disrupt part of the stress response. Now, there are conditions that can disrupt leptin, things like obesity, can cause leptin resistance. So you lose some of that signal and counteraction to ghrelin. Memory. It's interesting because acute stress can improve memory in certain situations. So it can potentiate memory formation, but in people who are chronically stressed, what happens is they get the memories, but they don't be able to recall the memories. This is why chronic stress is associated with memory issues and even lower brain volumes. And one of the things that can happen, we see this in PTSD, is you have a severe event and your brain remembers that, but you have trouble recalling it, all the details, and maybe you get triggered by something that recalls that memory, but it's not conscious. Chronic stress also, you see people with sodium retention and potassium wasting. They're directly related to elevated cortisol levels, and these are risk factors for high blood pressure. So retaining sodium, decreased potassium intake, or increased potassium excretion is a risk for high blood pressure, actually. We know that chronic stress impairs bone resorption, so healthy bone turnover. It decreases bone growth. It's been associated with decreased calcium absorption. Chronic stress causes death of certain immune cells, so it tends to be an immunosuppressant. And then you get an increase in appetite, and it's not the appetite for broccoli. People who are chronically stressed aren't like, you know what, some lima beans and an apple, that sounds really good right now. No, chronic stress is going to increase your cravings for sugar, salt, and high fat foods. Well, what comes with a lot of sugar, salt, and high fat? Processed foods, right? It leads to overeating. And then if you're chronically stressed, you get an increase in cravings and you're more vulnerable to addiction. Okay. So there are certain things that we can do. This is an example of a nerve cell, and we'll talk about this more in a minute. We'll talk about something called BDNF, brain-derived neurotrophic factor. It's very involved in the modulation of the brain, something called neuroplasticity, that's really important for overall brain health. Okay, so what are some metrics that we can look at for stress? Typically, when we're stressed, we'll have higher blood glucose levels chronically. You'll have an elevation in heart rate. You'll have a decrease in something called heart rate variability. So heart rate variability is, we tend to think our heart beats like a metronome, that it's consistent, but actually the time in between beats can be variable. And that's what heart rate variability is. When it's really low, it means that one of the two arms of your nervous system are dominating, and it's typically the sympathetic. So that means more fight or flight response. When it's high, it means the body is able to adjust between the two arms of the nervous system as it needs to. Then you can look at where we deposit our body fat. So there's a big misconception out there that cortisol makes you fat. It doesn't do so. It's all controlled by energy balance. We could do a whole nother talk on energy balance, but it's basically a factor of the calories you consume versus the calories you expend. Now, what happens is we can store our body fat in different places. Some people are really adept at storing their body fat under the skin. We call this subcutaneous fat, and that's pretty much metabolically inert. So it doesn't increase risk of bad things like all those cardiometabolic conditions that we talked about earlier. But if you store your body fat around your organs, and this is what we call visceral body fat, that is linked to a host of really bad things. Things like Alzheimer's and cardiovascular disease and diabetes, increased mortality. So cortisol tends to shift where you store your fat, and you store more around the organs. Then you can look at things like fatigue, brain fog. You can look at your own stress meter. Like, man, today things that usually don't bother me were really bothering me. That means you're probably stressed out. And then on the opposite side of that, look at, okay, you know what? That used to really bother me, but now it doesn't. That's resilience. And we're going to talk about resilience more in a minute. So, what can cause a dysregulation in stress? It can be physiological stress or physical stress. Like, again, I go and break your arm. That's a physiological thing. It's probably going to cause a little bit of mental stress too. Or it can be mental stress. It could be those automatic negative thoughts. It could be, a fixed mindset. We'll talk about that more in a minute. You can have stress that originates from a physical cause or a mental cause, and both of these cause dysregulation in our normal stress processes if they happen chronically. So what are some things that do that? Sleep deprivation. Sleep deprivation is known to increase cortisol levels. One study of total sleep deprivation, where they didn't allow people to sleep whatsoever. You can only do that for a short amount of time because you will die without sleep. And then partial sleep deprivation, where they allowed them to sleep 4 hours a night, showed a 37% and 45% increase in cortisol levels. And even a night of bad sleep in some people can dysregulate cortisol, and that elevation can last for 2 days. And then poor sleep habits, you see an increase in cortisol, an increase in blood pressure during psychosocial stress. So psychosocial stress is that mental stress, right? It's not the physical stress. It's not, someone's beating you up. It's something's beating you up in your mind. And so this brings up the concept of stress resilience. Stress resilience is we can't really control most of what happens to us, but we can control what we do about it. And people who are resilient, let's say if you have person A and person B, and you subject them to the same stressor, person A's stress levels go up to a 10. Person B's stress levels go up to 2. We would say that person B has more stress resilience. So encountering the same stressor, let's just say, you could hold everything else constant. One went up to a 10, one went up to a 2. That is stress resilience, the ability to encounter stress and deal with it in a more appropriate and non-exaggerated manner to cut off the acute stress response before it becomes a chronic stress response. And the insidious thing about poor sleep is then it leads to hyperactivity of the stress axis. We call this the HPA axis. And what this does is it increases sleep fragmentation. So you wake up more often. You get decreased slow wave sleep, which is the restorative deep sleep. And then it reduces total sleep time. So it's like poor sleep increases stress, and then stress increases poor sleep. And that's why it's called the feed forward system, because it just keeps on going and going and going on that hamster wheel till we do something about it. Nutrition. On average, about 60 to 65% of the foods we eat here are ultra processed foods. These are foods that have been taken from their original ingredient and been processed so you can no longer tell what that food came from. For instance, if you look at an Oreo, you have no idea what actual food that Oreo came from, right? That's an ultra processed food. Now there's some wheat in there and some flour and some cacao and stuff like that, but it doesn't resemble anything close to the original whole foods that it came from. These foods have been linked to all kinds of different things. Increased risk of early mortality. For every 10% increase in ultra processed foods, there's a 14% increased risk of death. They've been linked to cancer, diabetes, obesity. Most recently, they've been linked to increased risk of depression. And what the two main problems with these foods are, number one, they're deficient in nutrients. We're going to talk about some nutrients at the end that are important for stress regulation. Number two, they're high in calories. In fact, Lane Norton is the first person I see that talked like this, but he calls it energy toxicity. If we are constantly over consuming calories, that puts us into a pro-inflammatory state, because you're going to get an increase in body fat, and that's going to shift from a neutral or anti-inflammatory state to a pro-inflammatory state. So over-consuming calories is a pretty bad thing. Again, we could have a whole talk on energy balance. That's a pretty in-depth conversation. But the moral story here is what you eat matters, and especially when it comes to your mental and physical health. And we have a really good talk. I think Dr. Bernot has some really good talks on our YouTube channel about how you can eat for sarcoidosis and other autoimmune disorders. Inflammation. Now, unfortunately, autoimmune disorders like sarcoid are disorders of inflammation. We know that people who have sarcoid tend to have higher inflammatory markers. So what happens is certain of these inflammatory markers, like TNF alpha, trigger the fight or flight nervous system, and it activates pathways in the brain to do so. And then you get activation of immune system in the brain that leads to more of a stress response and maladaptive pathways. And then inflammation, chronic inflammation, and I really should preface that not all inflammation is bad. There's acute inflammation and chronic inflammation. Acute inflammation goes along with the acute stress response. That's good. It's normal. You need that. Chronic inflammation, that's dysregulated inflammation. That's bad. And so inflammation can also activate the stress pathways independent of cortisol release. Trauma. This could be either mental trauma or physical trauma. Trauma can lead to dysregulation in stress pathways because it can either lead to elevated cortisol or lower cortisol levels. Either way, again, cortisol is not all bad or it's not all good. Too low cortisol is a problem because then your body can't respond appropriately to stress. Too high of cortisol is a problem as well. Trauma can also lead to sensitization of the amygdala that we mentioned earlier and stress pathways. Okay, we talked about this earlier. Acute exercise, especially moderate and high intensity exercise, can activate stress pathways. But like we mentioned earlier, chronic exercise is actually a really good thing. So we'll talk about this more in a minute, about why exercise is beneficial for moderating stress. Obesity. Obesity dysregulates the stress pathway. And what it does is it increases the cortisol binding protein, thus decreasing the amount of cortisol available to help us deal with stress. So again, not all the time is the problem too much cortisol. Sometimes the problem can be not enough cortisol is available to help us deal with stress. Dysbiosis, or abnormalities in gut bacteria. So dysbiosis can change the production of neuromodulators. These are things like serotonin and dopamine. Certain bacteria in our gut, like bacillus, make dopamine. Certain species like Candida and Enterococcus make serotonin. Certain conditions can increase intestinal permeability. Some people call this leaky gut. Leaky gut is not a condition on its own, but there are certain gut conditions or inflammatory conditions that can increase the permeability of our intestines, meaning things can kind of slip through the intestines that aren't supposed to, and there's less regulation there. And what happens is you get more of these LPSs, these lipopolysaccharides. These are uh, certain molecules made by what we call gram-negative bacteria that are very pro-inflammatory. And these can now leak out of the gut and then go to other places in the body, causing inflammation. And then you get a decrease in something called short chain fatty acids. Butyrate is my favorite of these. It's anti-inflammatory. People with Alzheimer's have been shown to have lower butyrate levels in the brain. And butyrate may help regulate the microglial cells that we talked about earlier, those brain immune cells that are really important in maintaining that homeostasis, that balance in the brain. Insulin resistance. So if you look at insulin resistance, it's estimated that half of the American population, adult population, is insulin resistant. So about 15% are diabetic. The other 35% are insulin resistant, meaning that we have abnormalities in being able to process blood sugar appropriately. Excess sugar in the blood is bad. It attaches to things, it leads to inflammation, it causes metabolic disruption. So we know that people who have diabetes have higher levels of cortisol at baseline. They get a larger response to a stimulus, and it actually correlates. So the higher your A1C, the more you get an exaggerated cortisol response to a stressor. And then we also see people with diabetes have problems with a certain type of memory called declarative memory, and that is directly correlated with cortisol levels. So insulin regulation disrupts stress pathways. Okay, so lifestyle interventions. In lifestyle medicine, what I found is over time, the most important thing is what your mind thinks. People severely discount how powerful your mind is. And so the first thing I have people start with is mindset. Literally, your beliefs can impact your physiology. And we know this looking at studies, looking at the belief effect and the placebo effect. Now, the placebo effect, most people have heard of, right? You give people a sugar pill and there are physiological responses. It's just people don't really understand how powerful those responses are. You can look at any condition under the sun and and probably find a placebo-controlled trial where that condition was improved by the sugar pill. And so the placebo effect is giving somebody an intervention, even if they don't know that that intervention is active or inert, improves that condition. So we see this especially with pain medicine. We see this with even weight loss. The new weight loss drugs, the placebo groups lost weight. Not as much as the active group, but they still lost weight in placebo group. So you have to guard your thoughts. It's really important what comes into your mind. Those automatic negative thoughts that we talked about, you have to be able to cut those off. You have to have and grow and cultivate a mindset of positive self-talk, of positive affirmations. We know that actually affects your stress levels. That affects your cortisol levels, what you tell yourself and what you believe. So they recently did a study on placebo effect. This is really interesting. They had a group of people and they gave one a clear drink and one a pink drink, and they had them work out. And when they were given the pink drink, they did on average about 4 or 5 more reps than when they were given the clear drink. The drinks were exactly the same. It's just one was pink and one wasn't. But there's an association that like pre-workout comes colored, and the clear drink was associated with like water. And just that was enough for them to do more reps in the gym. And then you look at the belief effect. The belief effect is what you believe about a treatment matters. There's two really cool studies on this. One was they had people and they told them that they either had good genetics for exercise or bad genetics for exercise. And so when they told people they had bad genetics for exercise, their exercise performance decreased, even in those who had good exercise genes. And then when they told people that they had good exercise performance genes, their exercise performance increased, even in the people who had genes that would predict worse exercise performance. And that's the belief effect right there. Another study on this, they had people come in and they gave them a shake, and they told people that it was either a high calorie, very filling shake or a low calorie, not filling shake. And what they found was when people were told it was a high calorie filling shake, that they felt more full and the actual levels of ghrelin, that hunger hormone, were decreased. When they told them that it was a low calorie, not very filling shake, they found that people reported that they were hungrier and that they had higher levels of ghrelin, the hunger hormone. The thing is, though, there was no difference in the shakes. There was no caloric difference. They were the same in the two groups. So this was all the belief effect. What they believed about the treatment actually changed how they felt, but more than that, actually changed what was happening in their physiology. Ghrelin is a hormone. So they actually changed levels of a hormone. So that's why it's really important to have a proper mindset. Nothing, as your mind goes, the rest of you go. Like the expression, whether you can or can't, you're right. And so for mindset, I highly recommend the book Grit by Angela Duckworth. It is an amazing book on cultivating grit. I also highly recommend the book The Obstacle is the Way by Ryan Holiday. It's about stoicism, and I've really tuned into the principles of stoicism lately, because the Stoics, one of their key tenets is it doesn't matter what happens to you, it matters how you respond. And that's something I've really tuned into lately because, like I said earlier, most of what happens to me on a daily basis, I can't control. Like, I'm sick right now. I've been feeling like crud all day. I don't know if it's popping up in my voice, but I still decided to show up today and try to help people because that part's in my control. I can't control getting sick, but I can control what I do about it. I can't control that I get stuck in traffic. I can control my mindset when I'm stuck in traffic. Well, maybe that instead of getting angry, maybe this is an opportunity to start listening to that ebook. The Obstacle is the Way is the other book. Or maybe this is an opportunity to reconnect, call someone on the phone that I haven't talked to in a while. Maybe it's an opportunity for me to start doing some breathing exercises or meditate. So is it a setback or is it an opportunity? You have the ability to change your perception of that event. And that's why mindset is so important. Nothing else works. Nothing else I'm going to talk about or I've ever talked about works unless you get your mind in the right place, unless you start to frame things in a way that's beneficial and not harmful. And I'm not saying it's easy, it's hard, but once you get to a place where you are able to do that, the whole world seems different. Okay. So we talked about how poor sleep dysregulates stress pathways. So getting good sleep. How do we get good sleep? The biggest factor in controlling sleep is controlling light. Most of us are exposed to too much bright light at night. We have these bright overhead lights on till the moment we go to sleep, and that has been shown to suppress melatonin, the hormone that helps us regulate our circadian rhythm. Melatonin tells us it's dark. So if you're under bright lights until the moment you go to sleep, you've been telling your body the entire time that it's daylight, time to wake up. And that's gonna dysregulate your sleep. So what you want to do is use dimmer lights. Red light may actually help. And what we do is once it's usually like this time of night, we have all the lights on right now. This usually never happens. We have like one light that's on that's well away from us and it's pretty much dark, preparing our bodies for sleep. Another thing you want to do is get bright light exposure outside 2 to 10 minutes in the morning. This helps set your circadian rhythm. What else can you do? Work out early in the morning. Working out in the morning helps what we call the sleep homeostatic drive. As we go about the day, we start building up metabolic byproducts. And what happens is that one of these metabolic byproducts is called adenosine. Adenosine is how caffeine works. Caffeine blocks adenosine. So by blocking adenosine, it delays your threshold to get sleepy. So if you exercise early in the day, you start building up more metabolic byproducts earlier, it's going to help you sleep at night. And that's been proven in clinical trials. What else can you do? Temperature. It's really important to keep your room at night as cool as you can possibly tolerate. We sleep with like 67 or 68. The reason is not every cell in your body can sense light, but how your body knows where it is in its circadian rhythm is temperature. So if you are sleeping under 5 blankets and, thermal pajamas all the time, it's going to be hard for your body to cool down. That's going to impair your sleep. So these are all a group of techniques called sleep hygiene. Andrew Huberman has some really good podcasts on improving sleep. Oh man, I just blanked on the name of the book. There's a really good book. If I think of it, I'll put it in the chat on sleep. But improving your sleep is a good way to help you deal with stress. It helps make you more stress resilient. And I'm sure you've seen this all in your life. When you get poor sleep, how on edge are you? You have very poor stress resilience. When you get good sleep, you have much better stress resilience. All right, nutrition. I'm not going to go too far in depth on nutrition. We have those lectures by Dr. Benoit. But in general, you want to have a high nutrient dense plan that's high in fruits, vegetables, fiber, and then protein. We've talked about this before. But eating primarily whole foods will help provide you with the nutrients that your body needs to deal with stress. Be social. Loneliness is a problem. The Surgeon General's report actually from this past year was about tackling loneliness. Loneliness dramatically increases our risk for cardiovascular disease, for mental disorders. And if you look at it, being lonely is actually worse for our health than smoking. Being social increases things like serotonin and oxytocin. Oxytocin is what we call the love hormone. When you like pet a dog or you get a hug, you get increases in oxytocin. Oxytocin shuts off, it kind of acts as the brakes in the hypothalamus, one of the key regulatory centers in the brain, on the stress pathways. That's why things like being social, being active, being in a group can help tremendously with stress management. And then when you chronically do these things, it makes us more stress resilient. So I should have mentioned this earlier. When I talk about combating stress, there's really 2 things that I talk about. One is stress management. That's what do you do if you're acutely stressed, right? And then 2, there's stress resilience. How do I make myself more resilient, better able to combat stress? That I get less stressed, or if I do get stressed, the amplitude of that stress is lower. So exercise. Exercise is great for stress management and stress resilience. So acute exercise has been shown to improve mood, increase alertness, improve concentration. It's funny because people say, well, I'm too tired to exercise, but the data shows pretty clearly that exercise improves fatigue. And so it actually makes you more alert, more awake. So when people tell me, well, I'm too tired to exercise, I say, you're tired because you may be tired because you're not exercising. And that doesn't mean, jump off the couch and go to the battle ropes immediately, but start with a graded program, work with a trainer who's worked with people who have autoimmune disease, and build up your endurance and your capacity. And that we know chronic exercise tends to improve stress resilience. We see lower cortisol levels. We see improvements in heart rate, improvements in blood pressure, and improvements in what we call oxidative stress markers. These are markers of inflammation. So exercise is very, very important in an overall strategy to control inflammation, which is very important when you have an autoimmune disease. So hypoglycemia can activate stress pathways. So if you're someone who's prone to hypoglycemia, then it's a good idea to make sure that you carry some snacks around with you or you eat at scheduled times so you don't get hypoglycemic. Now, what about fasting? Before fasting, of course, talk with your physician. If you're on blood pressure medication or blood sugar medications, that fasting may cause some issues. But fasting, I think, is very important because not so much the metabolic effects, but it's doing something hard. In this day and age, it's really hard not to eat because calories are everywhere. And so purposely delaying that allows you to build up your willpower muscles. So to me, that's the main benefit of doing periodic fasting. I do a 12 to 24-hour fast every Sunday. Now, initially, being in a calorie deficit can increase cortisol, but it returned to normal after a few weeks. And fasting may help impart stress resilience. That data is not so fleshed out at this point, but there is some evidence supporting that fasting can help with stress resilience. There's some data showing fasting helps with mood as well. Mindfulness. This is things like meditation, breath work, yoga. Doesn't matter what you do. I typically recommend an hour of mindfulness a week. I do mine as a combination of breathing exercises, prayer, and meditation. Mindfulness can reduce cortisol, reduce heart rate, reduce blood pressure, and then it's been shown to improve heart rate variability and heart rate when we are exposed to an acute stressor. So mindfulness works on both stress management. If you are acutely stressed, it helps with enacting a normal stress response, but it also makes us more stress resilient over time. One recent study compared Lexapro, a medication for anxiety or depression. This study was in anxiety, to mindfulness, and it found that there was equivalent improvement in markers for anxiety between the Lexapro and the mindfulness group. That's huge because this study is showing that mindfulness-based exercises were non-inferior to a medication for helping people with anxiety. That's how powerful some of this lifestyle medicine stuff is. So we talked about mindset earlier. A fixed mindset is basically you are what you are. You're a done product. You've got everything you have. You were born with it. A growth mindset is with discipline, with work, with time, with effort. Who knows what you can become? The sky's the limit. And there's a really good book on this called Mindset by Carol Dweck. And this actually can impact us as far as stress. So there was one study where they looked at people who were depressed, and they found that those with a fixed mindset tended to stop doing the things that they love when they were depressed. But people with a growth mindset, and everyone gets depressed, right? We don't all develop major depression or depressive disorder. Everyone gets anxiety, right? That's a normal human condition, but it doesn't mean that everyone has an anxiety disorder. We all get depressed. It's just that most of us are able to reset after a period of time where it doesn't become a disorder. But they found that people with the growth mindset were able to resist the depression and maintain their lifestyle better while they were depressed. And so what the growth mindset can do is it affects the emotional inputs into the hypothalamus, and it decreases the anticipatory aspect of stress. So that goes into making you more stress resilient. because there is a large anticipation is huge, right? It's like, why do we distract kids when they get vaccines? Because you don't distract the kid. It screams bloody murder when you stick a needle in its arm. You do distract the kid and they act like nothing happens, right? Same stressor, but it's the anticipation. It's the same thing with pain. The anticipation of pain makes it worse. So having the growth mindset, you decrease that anticipatory arm, you make yourself more stress resilient. This little lovable goober is our dog Bane. We love him very much. He's a shepherd boxer mix. Emotional support animals, right? That's something that we've used for a long time. When you pet a dog, you get a release of oxytocin. We talked about oxytocin earlier. Not only do you get a release of oxytocin, the dog gets a release of oxytocin, and you bond. So having a pet can decrease our stress. Oh, thank you. He is a cute dog. He's a goober, but we love him. All right. So hormesis we talked about earlier, homeostasis, right? That's just the act of bringing the body back in balance. And then hormesis is these are eustressors. These are stressors that actually make us more stress resilient. Exercise being the preeminent one, fasting is another, doing hard things is another. If you want to have a comfortable life, do hard things. Because if you don't do hard things are going to find you. Sauna work. So I'm getting more and more bullish on saunas over time. People who routinely use the sauna seem to have a improved quality of life. They also seem to have a mortality benefit. I think it's like an 18% reduction in all-cause mortality by sauna use. Sauna use mimics exercise. It activates something called heat shock proteins. So it mimics some of the benefits of exercise. We know that sauna use lowers blood pressure, lowers heart rate, lowers reactive oxygen species, so lowers markers of inflammation, improves heart rate variability, improves sleep. Actually, people, when they use the sauna, they see improvements in mood. So they see reductions in stress, relaxation. They see improvements in fatigue and improvements overall in general health. So that's why I've been really bullish on saunas. We have an infrared sauna here at the house. I try to use it an hour a week. Okay, last, we'll talk quickly on some supplements. Again, these are just supplements. They are not meant to take the place of all of those lifestyle things. They're not meant to take the place of counseling. I highly recommend counseling to get some help with these stress management techniques. What time of day is best to use sauna? Whenever you can get it in, honestly. I know some people who do it in the morning, some people who do it at night. I typically do it in the morning just because that's I use it after the gym. There is some data that using it after workouts can improve recovery. Also, it seems to help with the ability to be more intense in your workouts because it increases your heat threshold. So you're better able to tolerate heat so you don't fatigue as easily in your workouts. So ashwagandha is one of my favorite supplements. I probably talked about that before, in doses of 500 to 1,000 milligrams. Of course, any supplement can interact with your medication, so do not just start taking these supplements. Talk to your doctor or pharmacist beforehand because they may not be right for you. I'm just reporting what the literature shows may be beneficial for stress. Ashwagandha, 500 to 1,000 milligrams daily, has been shown to lower cortisol, improve sleep, and improve stress resilience. Vitamin C is very important for our stress response. The adrenals actually have the highest concentration of vitamin C in the body. We need to consume about 200 to 300 milligrams per day of vitamin C. About 50% of the American population does not consume enough vitamin C. When we're stressed, those needs can go higher. It's a cofactor for making the adrenal hormones. And doses of 500 to 1,000 milligrams a day have been shown to decrease stress and anxiety. The B vitamins are very important for, again, some of these adrenal hormones. So B vitamin and mineral supplementation has been shown to reduce stress improve cognitive test performance, reduce mental fatigue, and reduce symptoms of anxiety and depression. Magnesium is so important. About 40% of people are magnesium deficient. 60% have inadequate intake of magnesium. And if you look at the symptoms of magnesium deficiency, they like really overlap with stress and anxiety. The symptoms of magnesium deficiency are fatigue, irritability, anxiety, muscle weakness, GI spasms, muscle cramps, sleep issues. Doesn't that sound like pretty much a laundry list of things that happen when you're stressed? So magnesium is important for making proteins, for making DNA, for metabolism, for neuromodulators, for heart function, for electrolytes. Magnesium activates vitamin D. Magnesium prevents the brain from getting too excited. It activates the major inhibitory brain chemical GABA. It's important for making serotonin. It's important for that BDNF we talked about. That's very, very important for maintaining normal, healthy brain cells. So magnesium glycinate is the form of magnesium that I take. We need about 320 to 420 milligrams of magnesium a day, 320 for women, 400 for men. Low magnesium levels are associated with increases in cortisol and those catecholamines, norepinephrine. One study showed a 300 milligram per day of magnesium. There was a positive response on stress. Another study showed 400 milligrams a day, showed improvement in heart rate variability during exercise and training. And then probiotics. So we mentioned earlier that our gut bacteria are important for neuromodulation. Certain species like bifidobacterium, bifidobacterium longum are associated with an increase in GABA. Certain lactobacillus species, acidophilus and reuteri, increase oxytocin. And so trials with these specific strains have shown reduction in stress and anxiety symptoms. So there was another recent study that looked at adding a probiotic to I think it was for depression, to an antidepressant, and people showed improvements. And so the authors said that adding a probiotic was a safe, effective adjunct to treating depression with medication. Okay, so you can scan this big QR code on the screen. This will take you to all of my social media, YouTube, all that stuff, our business, Nimbus Healthcare. I post a lot of information regarding lifestyle medicine, studies about lifestyle medicine. So if you found this useful, you can head over to these contact areas for more information. I saw that there was 2 questions. Oh yeah, the magnesium. Yeah, I mean, I take 240 milligrams of magnesium a day. Magnesium does lower blood pressure for sure. It's one of the things that increasing magnesium and potassium can help with blood pressure. It can help with stress. Magnesium, we talked about, it has neuroprotective advocate properties. So, most people could benefit from magnesium supplementation based upon the fact that many people are deficient and most people don't intake enough magnesium. Yeah, exercise. I'm glad you started with a trainer. I recommend, if you really want to get serious about an exercise program, get with a trainer. I got with a trainer when I first started. It helped me craft what I wanted to do, and then I went from there. Okay. Any other questions?
Hey, Richard, I have some questions that were sent in advance of your presentation. The first question is there any direct connection between sarcoidosis, anxiety, and panic attacks?
Yeah, so as we mentioned earlier, if you have higher levels of inflammation, and sarcoid patients typically on average have higher levels of chronic inflammation, that can increase stress levels. And so if you increase stress levels, then you're more prone to things like anxiety, depression, PTSD, all of that. So we see that pretty clear. I'm not sure on specifically if this has been looked at in sarcoid, but we know that in people who have high levels of chronic stress, or I mean, who have high levels of inflammation, they tend to be more chronically stressed.
Okay. Back to the exercise um, discussion. Is it realistic to expect much improvement in one of our patients' exercise capacity by using a CPAP machine or meditating?
Directly, no. Indirectly, absolutely. So using a CPAP is going to help you get better sleep. If you have better sleep, you're going to have better willpower. You're going to have a better mood. You're going to feel more energetic. So you're more likely to go work out, right? As far as meditation goes, it's the same thing. It's going to improve your mood. It's going to help you better deal with stress. So, in my opinion, those things are more likely to get you into the gym, and they may even help so that you're better recovered from your exercise.
Hmm. All right. All right, fantastic. Our next guest wanted to get your opinion on how to manage anxiety um, when you have a pacemaker, and this patient has a pacemaker due to a level 3 heart block.
Yeah, so a lot of the things that I mentioned here today, you're definitely gonna have to talk to your physician about, because I don't know about your cardiac history, but I think something starting off on the mindset stuff that we mentioned earlier, and the meditation is where I would start. Everything else, there may be contraindications like to doing exercise or the supplements. There may be specific nutritional things you have to do in that situation, but really honing in on your mindset and the meditation, the mindfulness aspect, that's where I would start.
Okay. Have you heard of burn pit veterans?
No,
Okay. Okay. Um, how about physio loss?
I haven't heard of that either.
Okay. Um, this is a good one. You know, um, this patient is looking for ideas on how to manage stress, which comes from healthcare providers not listening to new problems due to sarcoidosis or side effects from medications.
You just have to be your best advocate. All right. Then we had a talk about patient advocacy. Abigail, if you want to link that, um, that's really what you have to be, and you just have to be adamant. And if they don't listen to you, move on to the next one,
Yeah.
right? Some doctors are not all equal, and some of us have more emotional capacity and better bedside manner than others.
Yeah.
So that would be my advice. There's some really good information in that patient advocacy talk that we did. But just stick up for yourself, keep at it. And if you're not liking what you're hearing, it's perfectly fine to shop around.
Yeah. I totally agree. We got one more we're going to get in before the wire. So we have a pulmonary patient with sarcoidosis is looking for tips for stress when symptoms, i.e., skin lesions, rise or disappear prior to an appointment with a provider.
Hmm. So it sounds like what's happening here is that you're getting stress hives, which is a real thing, right? And the going to the providers causing stress, that's not uncommon. We have white coat hypertension. I've seen people's blood pressure and heart rate shoot through the roof when they're in the office, right? And then they send me values at home and it's stone cold normal. But every time they come in the office, it shoots through the roof, right? And so I think working on the stress resilience stuff will help in the long term. But before you go into that office, do a couple minute breathing exercise. Even before you leave the house, do a couple breathing minute exercise, and then work on the mindset. It'd be like, what is really driving that stress reaction when you go to the provider, and then chase that down to a logical conclusion, right? And be like, is what's the worst that can happen? Okay, they could tell me bad news. Okay, then what am I gonna do? Well, I'm gonna figure it out, right? It's just working on that mindset aspect can help prevent that from happening.
Wonderful, wonderful suggestions. And the mindset it seems like it's very, very important and is a good place to start, along with various other things that you shared tonight. Dr. Harris, we greatly appreciate you taking time to come in. This is a real life subject. Many people are dealing with it. And this is, I think, the details and the nuggets you've given us this evening are definitely going to be helpful to our patients and to some of the caregivers that help to take care of their patients. In closing, would you be able to share any thoughts from tonight's webinar that you'd like to share?
No, I appreciate you taking the time out of your evenings to come and listen to me ramble for an hour. And I hope it was informative, and I hope it helps. And maybe, take what you learned here and put it in immediately. Do a couple minute breathing exercise when we get off of this. And if you need to know what to do, check out our talk with Breathe Fit. A couple of guys I know here in Houston very well who use the power of breathing every single day to help people. And I'll do a quick story before we get off. I walked into their office the first time, and they put a 45-pound weight on my stomach and told me to do diaphragmatic breathing with it. And I had done a little bit of it, but I kind of struggled, and they laughed. And I said, "What's so funny?" They go, "We have 75-year-old women with COPD come in here, and they can do 4 plates." It just shows you the power of hard work and resilience when you put your mind to something.
Yeah. Yeah, really good story. Really good story. Well, again, Dr. Harris, thanks for sharing the information this evening regarding combating stress, especially when you have sarcoidosis. We greatly appreciate it.